Hey everyone, Dr. K here coming to you from Integrative Health Management. Getting on to organ systems, I think we're at part 4, but the next part that I wanted to talk about was your adrenal glands, because gosh, the adrenals are so important. They are tiny little triangular little organs, but they sit on top of your kidneys and they play such a huge role. As small as they are, they play such a huge role in your system. So they get communication from your hypothalamus, which is kind of inside your brain there, and to pituitary. Those two little organs send a signal down to your adrenal glands to produce ACTH or CRH. So those are all signaling modalities for the adrenals to do certain things. So it is a big feedback loop within our whole body. All our organs communicate. So if something's not right in here and here, there's some block in communication to get down to your adrenals, that can cause a lot of problems. But we're just going to talk about adrenals today and what these amazing little organs do. So they are little triangular organs. They sit on top of your kidneys. So kind of your kidneys are in the back. If you look in your back, they're kind of sitting back there doing lots of stuff. So the adrenals have an inner part and an outer part. So an inner cortex and an outer cortex, or the inner part's the medulla and the outer, there's an outer cortex. So your adrenals, they have so many functions. So they control your metabolism. They regulate your metabolism. They regulate your sugar regulation. They regulate your immune system. They produce hormones to help with your blood pressure. They handle your stress response. So they produce things like aldosterone, epinephrine, norepinephrine, cortisol, big one, adrenaline. These are all, and a little bit of progesterone, also a little bit of testosterone, a little bit of estrogen. Those are, female and male hormones, but they produce a little bit of those as well. So these little guys really have a huge role, and they get really taxed. They just get really affected with stress. So when we look at the adrenal glands, the outer cortex has 3 layers: the zona fasciculata, the zona glomerulosa, and the zona reticularis. And all these, there's 3 little layers, and they all produce different things. So your zona fasciculata produces your cortisol, which we know is the stress hormone, but your cortisol does so many different things. It has a role to play in your blood pressure. It's a glucocorticoid, so it controls how your body deals with fat digestion or fat utilization, how you utilize your carbs. It plays a role in your immune system, in your blood pressure regulation, like I mentioned. It also plays a role in decreasing bone formation in certain parts of your body, and a big one is your sleep-wake cycle. So big little, but it's a really important part that regulates and helps you sleep, and really just plays a really big role in your stress. So your cortisol really gets affected by your stress. When you go to the zona glomerulosa, that is the second little layer, and that produces a hormone called aldosterone. Aldosterone has a big role to play in your blood pressure even further. So it regulates your electrolyte balance, it regulates your pH balance, how acidic or how alkaline your body is. It helps your kidneys out. The aldosterone helps your kidneys out to figure out how much potassium it has to absorb, how much sodium it has to absorb or release. So it plays a big role in that end. And then your last layer, the zona reticularis, produces your androgens and your DHEA. So that further supports your adrenals. And those are just extra different hormones. So if we don't have enough of those, you could be more high strung, you could be more fatigued. So that's the 3 layers of the outer cortex. Then we get into the inside. It has like the inner part, which is called your medulla. And the medulla part of the adrenals produces your adrenaline, which is also known as epinephrine, and norepinephrine, also known as noradrenaline. These are, again, more of your stress hormones. They regulate your heart. So when you're under, these are your fight or flight response hormones. So they start to go out and regulate how your vessels constrict. When you're under a lot of stress, your body's going to have to mobilize some nutrients. It's going to need some extras. So these hormones start to help the body pull from different areas to deal with the stress response that you have. We don't want to be in this state all the time. We're not meant to be in this state because it starts to deplete the body of a whole lot of things. It starts to throw the sugar off. It starts to constrict blood vessels, which means you're not going to get blood supply to certain areas, which means you're not going to get nutrients to certain areas. So it kind of just helps you deal with that moment. Unfortunately, a lot of us really run around with a very stressful life and have these hormones constantly being produced, and that is screwing up the system. So that's an overview of what these little adrenal glands do. Even though they're little, they're pretty big. So there's a lot of talk about, adrenal fatigue, and some doctors feel that's a real thing, and some doctors feel it's not. It totally is a very real thing. There's about 3 stages and a 4th stage. We all really kind of hit stage 1 of adrenal fatigue, and that's where you're tired, you're kind of feeling run down, but you get wired, but you kind of push through. Then we get into stage 2, where again you're just even more wired, even though you get more wired, but you're tired and you're starting to feel the fatigue and you're starting to feel the weight of it. And that, if it continues, will go on to stage 3. And stage 3 is when you start getting, chronic fatigue, not being able to sleep, lack of sex drive, chronic infections. Those things start to happen. And if then that just continues and you're not doing anything about it, you start to lose more interest, you start to lose more enthusiasm, and you head into stage 4 of really adrenal burnout. That means you're not producing all these hormones and they're all off, and you start to get depression, you start to get anxiety, which also starts to happen in the stage 3, but it will move even further and even deeper into stage 4, and you really start to get major disinterest, massive low sex drive. You just kind of don't really know why. You can't sleep, or you sleep too much, and you're just off, and you're irritable and you're angry. And a lot of times you're like, yeah, work is a lot, and then you blame it on work, but it's like your adrenals are a result of this, and they're working into a result of this, and they're burnt out. They can't keep regulating you. So if you're getting into this stage and you kind of don't know why you're having symptoms, it's probably a combination of hormonal to adrenal. And this is something that I really look at with my one-on-one clients when they're coming with symptoms and they don't really know why, and we can't get answers. This stomach, hormones are things that I really look at to get answers. So if you're starting to get these symptoms and there's things in your life that are stressing you, but you can't, you've tried to do some meditative techniques and you're not getting relief from it, and it's starting to get heavy, it's time to start looking at these and just finding the source, because they can be corrected. It just may need a little bit of supplementation, changing a few little things, and a lot of times things can get a whole lot better. The adrenals, unfortunately, are a little slow to heal when they've been burnt out for a really long time. So this is something that I really look at. And when I work one-on-one with clients, this is something that we do. And we have multiple techniques that I can use to get things corrected, get you back on your way. So if you're not sleeping, I am doing sleep consultations, insomnia consultation evaluations to figure out why you're not sleeping, because this may be one of the causes, and you just may need a little supplementation of something to get things turned around. So if you have any questions, if you're starting to have some of these symptoms and you're not sure why, please reach out. Let's find the cause so that we can get you on a healthier track and get you sleeping and get you feeling better and get your interest back and get your enthusiasm back and just get you feeling better, because that's important. So if you have any questions, I will leave my website below and my email below. Please feel free to reach out and let's chat about it. And there's, an easy test we can do just to figure out whether this is happening. A lot of times little side note, I get saliva tests that measures your neurotransmitters and your, cortisol levels within the whole body. A lot of times if you go to the doctor, they will get a serum cortisol. Not exactly accurate, because it's only measuring the amount of cortisol in the blood. And a lot of times you could be in a subclinical state, meaning you're in the range, but you're at the lower or higher range. So that's not quite normal. You want to kind of be in the middle with the figures. So much better to get a saliva test and a full spectrum to see more details, and let's get it fixed for you. So till we chat next time, take good care.